The experience of losing one's virginity is a multifaceted and deeply personal journey that varies greatly among individuals. Addressing the question of whether losing your virginity hurts requires a nuanced understanding of physical, emotional, and psychological factors. It is important to note that every person's experience is unique, and while some may report pain, others may not. So our response to this question aims to explore the factors that contribute to potential discomfort during the first sexual encounter. Physiological aspects play a crucial role in determining whether losing one's virginity is accompanied by pain. For many individuals, the concept of pain during first-time intercourse has been associated with the breaking of the hymen, a thin membrane that may partially cover the opening of the vagina. However, it is crucial to dispel the misconception that the breaking of the hymen is the sole cause of pain. The vagina is a muscular, elastic canal that can stretch during arousal and sexual activity. The hymen is a flexible tissue that can stretch and may not necessarily tear during sexual activity. Not to mention the fact that some individuals may not even have a noticeable hymen at all due to various activities like sports, tampon use, or natural variations in anatomy. A study published in the British Journal of Obstetrics and Gynecology emphasizes the diversity in hymenal morphology, challenging the notion of a universal standard. So, understanding the anatomy of the genitalia is crucial for individuals engaging in sexual activities. Emotions and psychological factors contribute significantly to the overall experience of losing virginity. Anxiety, nervousness, and fear can heighten the perception of pain. Societal expectations, cultural beliefs, and personal values may also impact one's emotional state during this intimate moment. Research indicates that adequate arousal, emotional comfort, and communication between partners play pivotal roles in reducing potential discomfort or pain during first-time intercourse. Adequate foreplay and natural lubrication are essential for a comfortable sexual experience. Insufficient arousal can lead to friction and discomfort. Engaging in activities that promote arousal, such as kissing, touching, and communication about desires and boundaries, can enhance the overall experience. Lack of arousal may be linked to anxiety, lack of communication, or hormonal factors. Incorporating additional water-based or silicone-based lubricants can help reduce friction and enhance comfort during penetration. The American College of Obstetricians and Gynecologists emphasizes the importance of lubrication in reducing discomfort during intercourse. Communication between partners, trust, and a positive emotional connection can mitigate anxiety and contribute to a more comfortable experience. The choice of sexual positions and the technique used during penetration can influence the level of discomfort. Experimenting with different positions, taking things slowly, and ensuring open communication between partners can help discover what feels most comfortable and pleasurable for both individuals. It's important to recognize that any discomfort during the first sexual encounter is not indicative of future experiences. With time, practice, and open communication, individuals often become more attuned to their bodies and their partner's needs, leading to a more positive and enjoyable sexual experience. In addition to emotional and physical readiness, it is crucial to prioritize safe sex practices. Proper use of contraception to prevent unintended pregnancies and protection against sexually transmitted infections is essential. You need to prioritize your comfort and well-being during sexual encounters. Engaging in sexual activities when you feel emotionally ready is a crucial aspect of a positive first-time experience. Consulting with a healthcare professional or a sex educator can provide valuable guidance and information tailored to your circumstances, helping to address concerns and promote a healthy and satisfying experience. In conclusion, the experience of losing one's virginity is a complex interplay of physical, emotional, and psychological factors. While some individuals may experience pain, many others do not, and the degree of discomfort varies widely. Understanding the factors that contribute to potential pain, such as the presence of the hymen, emotional state, lubrication, and sexual technique, can help you approach this intimate milestone with greater awareness and preparedness. Open communication, trust, and mutual consent are crucial elements in fostering a positive and comfortable first sexual experience. It is essential to recognize that each person's journey is unique, and seeking information, support, and communication with a trusted partner can contribute to a more fulfilling and enjoyable sexual life. Thank you for watching. If you would like to support us, subscribe now to stay updated on the latest videos, insightful discussions, and exciting content. Don't miss out on the fun, hit that subscribe button and engage with us to be a part of the conversation. Your voice matters, and we can't wait to share this journey with you.